Hi, I'm Chris Good. I'm Barbara's spine surgeon at the Virginia Spine Institute. You've obviously seen what a phenomenal person Barbara is and just how motivated and active she is and how she's overcome a severe spinal problem. My hope is to just give you a little inside peek more on the medical side, explaining what was going on and what we did to help her get through a really complicated situation. And so she had a previous surgery for scoliosis years ago. And so that was a surgery that fused many levels in her upper back, her thoracic spine. And we can actually see that on an x-ray. This is as if we're standing behind, so the pelvis here and the shoulders here. This metal you see here was kind of an old school scoliosis fusion from long ago. And then as time went on, she was extremely active and living a full life, but the spine that was remaining below her fusion also developed a complicated situation where the disc started to wear and tear and the spine started to twist, causing a scoliosis. And as was pretty common for people who needed this surgery years ago, ultimately the levels below wore out. Now, at one point, she actually developed a pinched nerve at one disc, and another surgeon tried to go in and kind of do a spot weld to buy her some time there. But she's now presented, and despite how hard she works and how active and healthy she is, really getting to the point where she's very, very miserable, not only from pain in her back, but an inability to stand up straight and nerve pain going down the legs. And so if we look at what's going on, I'd like to point to the side view of her spine. Now, normally our low back curves inward. Okay, that's what we call lordosis or sway back. And inward curvature of our spine is critical for us to stand up. If people have a condition where their discs degenerate or they have a fusion that is in a bad location, it can cause this forward posture. That causes tremendous stress on the muscles of our back. It causes a huge amount of energy to be wasted on our bodies and leads to very severe pain. And in fact, if we look at people who have spinal curvatures, people who are stuck in this leaning forward posture are actually the people who have the most limitations in terms of their quality of life. And so we were in a situation where we knew she'd had this surgery before, and all of the remaining discs in the low back had gone bad, leading to these terrible posture issues. Now, if we look at her more coned-in pictures, now we're just looking at the low back. We can actually see that, unfortunately, the surgery that she had before, which was meant to be a fusion to weld the bones together, that fusion didn't take. But she's had severe degeneration of the other discs in her back. And we can see severe pinching of the nerves, or what we call spinal stenosis. And so she can't stand up straight, and the nerves in her back are being kinked, which is causing nerve problems going down the leg. So this is a very severe spinal problem that she's up against. And so when we start talking about this, we have a lot of goals for her surgery. Number one, we have to unpinch these nerves to stop her nerve damage. Number two, we have to fix the instability where all these bones are unstable and sliding and curving. And three, we have to realign her spine so that she's able to stand up straight. And if we don't achieve all three of those goals with the surgery, her chances of a good life are not nearly as high. And so what we ultimately did was a relatively complicated surgery where we went into the discs to remove the discs, including fixing the fusion that didn't heal before. And we put in really angled implants to realign her spine. And then we did a surgery to connect her old fusion down and unpinch the nerves, called laminectomy. So if we look here, we can see the pictures of her x-rays before our surgery and after. So we can see the upper part is the same, but now we've fixed onto her spine with multiple implants, bringing her fusion all the way down, so there's no more instability or curvature. And if we look at the side view of her back, where she was horribly hunched forward, we can see that we've restored a curvature of her back using all these implants. So now when she stands, her head lines up just over her hips, and she's able to stand with great posture. And so we're able to take care of the spinal instability, unpinch the nerves with laminectomy, but also, very importantly, realign the spine. all those components have gone into getting her back to the kind of lifestyle that she's having at this point. And obviously you can't say enough about the amount of work that she has done in motivation in terms of getting back in shape and rehabilitating. Because no matter how excellent a job we do at this part, it's a tremendous amount of work for a patient to go through a surgery like this. But I think she's proof that it can absolutely be worth it. And she's come out on the other side, tremendous success, and we're so happy for her.